This episode of Southeast Iowa Today is brought to you by Griner Auto Body of Washington, Iowa, using state-of-the-art techniques and decades of experience to get your car back on the road after an accident. Car Doctor of Washington, Iowa. No matter who Frankensteined it, they can fix it, clean it, and customize it. McDonald Boatyard of Keota, Iowa, for all your farm equipment and auto recycling needs. For great food, it's Your Choice Family Restaurant of Wayland, Iowa. Open Tuesday through Sunday. Try the John Bain sandwich on your next visit. Girling Repair of Winfield, Iowa. If your mower is dead, call Fred, your Husqvarna, Aaron's, and Gravely dealer. Fred also fixes and sells snowblowers. B&B Propane and the family of jet stops. CW Tree Trimming, LLC. We're into your trees, not your wallet. Serving all of Henry County and the surrounding area, and we offer a senior citizen and veteran discount.
Iowa Technology Systems delivers professional IT services. From company networks to home computers, we keep you connected with reliable service you can trust. Enterprise IT services, quality computers, and local IT support. All designed to keep your technology running smoothly. Visit www.iowatechsys.com to see how our services can help you.
Dutch Market and Coffee Talk of Washington, Iowa. Dutch Market can handle all of your grocery needs. They even have a conference room that you can use for free. Coffee Talk's drive-thru is open and ready to serve you coffee, energy drinks, sandwiches, baked goods, and ice cream. They all present the award-winning Southeast Iowa Today. Here's the author of Christie's Journey, The Beat Goes On, and your host, John Bain.
Thank you, announcer Cody Roy of NewEnglandDukes.com for your golden pipes and wonderful introduction. It's Tuesday, January 6, 2026, and I'm at the Henry County Courthouse in Mount Pleasant, Iowa. Today, the Henry County Board of Supervisors held interviews with three candidates that want to be on the Henry County Board of Health. The candidates were Gloria Fear, Bryan Messer, William Grimm. Next, I will show you the interview process, and you will see who the board decides on. And if you read about this and, somewhere, your local newspaper, or you hear about it on the radio, I want you to know those folks weren't here. So if they use any of this stuff and quotes that are word for word from my podcast, they better darn well source me.
Okay, it is 8:30. I'd like to convene this work session meeting, interview day of the Henry County Board of Supervisors. This is to fill a open vacancy on the Henry County Board of Health. We have 3 interviews today. First one will be Gloria Fear, local address. Gloria, would you mind coming up here?
Absolutely.
Gosh, you seem to know everybody.
Well, when you work in the public, Steve, you know a lot of people.
That's a good thing.
It is a good thing.
So, I guess, Gloria, we have 6 prepared questions from our HR firm that we are going to field to you and get your responses back, and then just do an open chat session a little bit with you and go from there. So, Steve, would you begin?
Sure, absolutely. Yeah, I looked down through your application, Gloria. It's pretty thorough. You've got a lot of experience, so I appreciate you making the application and taking the time to give us all the background that you have. That's really thorough as compared to what we've seen in some other applications, so thank you for that. So, looking through your application, you said you were interested. Can you just give us like your personal overview of why you're interested in doing this, other than me just reading what you said here, so we get a feel for that?
Well, of course, with my background, I thought would be a good fit.
Yeah.
And I retired from that profession.
40 years, is that right?
Yes, it's true. And just want to get more involved in the community at this point.
Okay. Want to stay active?
Yes, absolutely.
Okay, excellent, thank you.
And we know what you've done professionally, what you've stated here, and knowing you also, but what you've done, how do you see that relating to the public health board, or what does that bring to the board?
I just feel like my education with a background in the healthcare will certainly benefit. There's things I need to learn yet, which I'm interested in learning. The budgetary process, I don't know a lot about that. I have ideas. I'm a team player. I work well with others, I think, and if I don't, I will approach that person and see if we can iron all that out.
Good.
Question 3 here, can you describe any experiences you may have working with diverse stakeholders, including public agencies, healthcare providers, and group, community groups? We've looked at your interview, like Steve said, pretty extensive and detailed. It looks like you had done medical surgery, so that I would think, being a non-medical person, that is kind of a specialty group there that you would deal with. Healthcare providers, you would have a variety of different healthcare providers, so there'd be, anywhere from the one end to the other, I guess I'll say, so.
True.
So, can you unpack that, any special experiences like that might pertain to here?
Well, as you all know, there's many different personalities, and I've worked with a lot of different surgeons that have a lot of different personalities, but I felt like I had a good working relationship with all of them, and held their respect as well as I respected them. And as far as working with other committees or agencies, when it comes to discharge, sometimes patients need a little extra care, so you have to reach out to public health or a home care and make those arrangements too.
One thing that I view this as 40 years of experience in a local hospital. I mean, that seems to be the ability to meet with 40 years of people over the years of different age groups. Do you like working with more of the aged group or the young people, or, public health? I mean, Katie, public health. More of the.
It covers it all, so we cover everybody. Public health is rooted in equity, so basically we're trying to level the playing field so everybody has the same opportunities to achieve health as everybody else. Go ahead.
I guess running with that, so some of your patients and you're used to working with people of all age brackets and all groups and things like that.
Yes,
So, if I understood you right here.
Correct.
Okay.
So building off what Katie was just talking about, then, have you worked with public health in the past in any capacity?
No.
Like relationship from the hospital over or anything like that? Not at all at this point? So it's a different field, different perspective then?
Absolutely.
So can you give us your perspective of what that means, working with public health? In the broader sense that Katie was just talking about?
I know that they work from infancy through, and like she said, to keep everybody healthy in the community. I understand that totally. What was your question again?
Just the broader perspective, on your perspective rather, of public health and how that would build into what we see from what Katie's explanation was just a few minutes ago. She was talking about the broader scope from birth to death, pretty much.
Right.
And you've kind of experienced all that.
Absolutely have, as a very young nurse. I worked on the medical surgical unit, and experience death on that floor quite often. I can say that there's only been maybe one occasion where I experienced death in the operating room, and they were that elderly.
Mhm.
We did do pediatric surgery, so I have a lot of experience with them, and I feel like I've run the gamut of the patient care. It's just a whole different kind of nursing that they do, which I have recently attained a PRN nurse, which just means when they need you in the school, in the Mount Pleasant School District. So that too is a community health kind of thing. There's lots of teaching that we do there. And it's a totally different kind of nursing than I'm used to too. It's a lot different pace.
Okay. And from public health, you also take in a little bit of the environmental health aspect as well. So, get any background with environmental health applications?
Well, we do lots of, no, not really. Lots of cleaning.
Yeah. Katie, what would that involve from your
So,
perspective?
kind of environmental health standpoint, for water quality, we work with Roth. And they do well water testing, capping, issue permits, but also from environmental health, we are looking at things like what's in our environment radon. There's a big push for that because it's one of the leading causes of lung cancer. Other environmental health concerns, we look at climate change is also a piece of public health. It's quite broad. Lead testing, we do that at public health. We also have a certified lead inspector that is on staff to go out to homes if we have to, if we have kids that are testing with high levels of lead. We farm out our restaurant inspections, that's all through Lee County, but they cover Henry, Des Moines, Lee, I can't think if they cover Louisa too. But that's kind of more the environmental health aspect of it, so we do have a little bit of that too. And then the board is responsible for, like, if we have environmental health complaints, which they do come up from time to time, if we have issues with illegal dumping, if we have issues with homes, people will call quite often for mold issues, bed bugs, the gamut. So that all comes to us too. So
That's a good explanation. More than I needed. There you go. Not unusual, right, Mark?
I got a frog in my throat here. No, go on. You've already said something to my next question, but let me expound on it. You talk about working as a group, conflict resolution, things like that, working with doctors or whatever, and have different personalities. Can you go explain a situation that you might have had without names and stuff, that a conflict resolution or working cooperatively together to get to the end cause?
Absolutely. So when you put humans together, we all have different thoughts. And some people are like oil and water, and I have worked in those situations where there was two nurses that were very much oil and water, I mean, just in their presence of each other. And there was a day where it got very heated between the two of them, and you just have to separate them and hear them both. I think that's important, that you have to let them know that you hear both of them, but they have to work together, so we have to find that common ground with them. Not an easy task.
So you were able to resolve this situation?
Yes,
Good.
that day.
Not saying it didn't happen again, huh?
Right.
Okay.
But I think in the medical field, if that problem was something medical, I mean, you might be directed from a doctor from taking one course of action where you personally maybe don't agree with that, but there's a hierarchy there that you have to follow. Is that?
That's correct.
That's correct.
You can certainly question them
And
and should if you feel like
Yeah.
it's not correct.
But, you know, there's a hierarchy in the board of directors. There's a chairman that sits, and everybody has differences of opinion, and then you blend those opinions together and come up with a game plan to give them basically to Katie to move forward with the end goal and everything. And I guess what I'm hearing is you feel like you could be part of that team play there.
I absolutely do.
I think you probably know some of the other board members
I do.
and have
Journey
experience.
and Lois.
Most
Have
of them,
experiences with
yes.
them and
I like to know
Katie.
everybody, yeah.
Yeah.
You work, like she said, you work in a hospital.
You work in a hospital,
On
you
the school
learn.
board, you know everybody in town.
and they probably know you,
Not everybody, but
a lot of them.
A lot of people.
a lot of people.
A lot of people think they know me when they don't, but it's okay. Or they get me confused with the other Lois.
Yeah, that has come up a few times.
Anything further, guys?
No, I think I'm better understanding, and the application, like I said, was pretty thorough. Well, that's, makes me feel pretty good about where we're at with Gloria. Anything you wanna say? In summary?
I appreciate you guys giving me the opportunity to at least look at this. I've definitely learned just reading some of the minutes of because I really hadn't dug into a lot of that until, well, Chad called me and told me, hey. So, yeah, I've learned a lot about it already, so,
That's good.
yeah, absolutely.
No, when we knew that there was an opening, I called a number of people and put that bug in people's ear to consider that, think about it. This was way before the holidays and everything, so think about it. Some people thought real shortly about it, evidently, so. But some give it some in-depth thought. So.
Katie, anything you wanna say?
Well, I just wanted to know, do you have questions about what we do or how often we meet or just the function of the board?
I've covered that. I mean, I've researched all of that. The description of it says you meet 6 times a year, but it looks like you meet more often.
Yeah, we
than that.
usually
And-
meet about once a month.
Yes.
Typically on Wednesdays is what's been scheduled right now. We usually meet at the public health, conference room. Lois is our chairperson, was for the last year, so, we do meet tomorrow. Our vice chairperson is Mike Hampton. It's a 5-member board, quorum is 3. We follow Iowa code as far as what we are responsible for, and it's all spelled out in there. And it follows the foundation of the 10 essential public health services, which we can go over all that. There is some training that is required with it, so we have a regional consultant that comes from Iowa Health and Human Services, and we're in Region 5, and she would come down and go through the functions of the board, open meetings laws briefly, because there is now, as of July, a law required for anybody who's elected or appointed to a board to go through an open meetings training, and that's free. It's online. It's kind of like a do at your own pace deal. It's like 1.5 to 2 hours, but the regional consultant will go over those things with you and kind of be a liaison if you have any questions. We work with a lot of different counties. We have relationships with most of our surrounding counties, and then even some that aren't in our region. As far as, I guess, Lois, you've been on the board for quite a while. Do you have anything you wanted to add?
Not that I can think of, other than I don't know that we asked this last question about if you have a potential conflict of interest between your personal views and the responsibilities of the board member. How would you deal with that, Gloria?
If I have a conflict of interest, can you read that again?
How would you handle a potential conflict of interest between your personal views and your responsibilities as a board member?
You have to hide your own and go with the board, whatever's right, even if I don't feel like it.
That's been kind of touchy lately. There's been a lot of controversy surrounding immunization practices, so that's probably our touchiest right now. So everybody has their own personal views. on whether they want to be immunized or not, but really what is good for the overall health of the community is what we have to look at, and what does research show and what does science show. So sometimes, you know, there might be things I don't agree with, but you know, in the greater good, then we have to set our own biases aside and do what's best for the community.
And come along with that's the idea of having a board. I mean, you get that diversification of ideas and you can bounce things off, because I don't agree with these guys all the time. They don't agree with me sometimes. That's what a board is bouncing ideas back off one another and coming to a common ground for the common good, basically. Yeah. Anything further?
I have nothing.
Not for me.
Okay.
Thank you very much.
Absolutely.
Well, appreciate you coming in.
Am I dismissed?
Good seeing you again.
Good to see you, Mark.
Nice to meet you.
Nice to meet you.
They said, Steve said the other day, you know Gloria? And I said, well, I've known her since she back me high.
Yeah.
How many years were you born when your folks moved?
I was 3.
I thought it felt right then.
Yeah.
All right.
Yep. Grew up here.
Thank you.
Bill
Have a
Grimm.
good day, everyone.
Yep.
You too, take
All
care.
right, thank you.
If Bill Grimm's here, I would not object to moving it forward a little bit, but he would
That'd be great.
schedule a 9 to 9:15-ish timeframe. I
Whatever.
really didn't know how long the interviews would be, but if he's here, I'll
Okay, sure.
Pfeiffer Sawmill, your local home for kiln-dried lumber and affordable trailer decking to your specifications, all in Rome, Iowa, serving Mount Pleasant and all surrounding areas. Do you like to throw a hatchet? They've got your board. Call Ben today at 319-931-4544.
come up, have a chair right there.
You sit there or
And
here,
I was gonna say, just enter the circle of trust here,
in the middle or in the edge? You tell me.
wherever you would like.
Yeah, right there.
Right there's good.
Well, you're asking questions too, right?
Um,
Maybe? Okay.
maybe.
Good morning again.
Morning.
Brian, we appreciate you coming in. We realize that a little bit of a schedule change up. We waiting. The first interview didn't take as long as what we thought it might, so.
Oh,
Okay.
I can go back out, that's okay.
Okay. Well, you're here. Let me talk.
No, it's okay. Let's just stay on schedule.
Chance Chairman, we'll let him
Okay. well,
step up.
Yeah. Would you mind waiting a few minutes? Okay, no problem.
Okay.
But we've had our HR person put together a list of questions. We got your application that you completed and provided to us. Everybody's had a chance to review that and everything, so we'll go through the questions, and at the end, we'll have a little bit of a session if there's information on, from Ms. Roth or Katie or anything, that's fine. Steve, would you start, please?
Sure, absolutely. I appreciate your application, Brian. I know you've been around for a little while now, going to meetings for about a year and a half or so, and I've seen you there personally, so I know that, and I see that in your application as well. You have been attending those meetings and getting familiar with what's been going on throughout the community and the public health and the environmental health perspective of that. So can you just give us an overview of your interest in that and why you would like to be a part of the board?
Well, I think that comes back to something that I've always tried to adhere to. For once, Oprah had a quote that said, helping others is a way we help ourselves. And one of the things that I've always taken some great pleasure in, I guess, working in the healthcare field is when you can have a positive impact on somebody's life, whether that's through achieving some physical goals on the football field or in life and returning to work. That is very rewarding personally. So it's a combination of wanting to do something to help the public through actions on the board to help public health do that, for both public service and mine, right? So those are the interest in why I would do it. But there's several programs out there that I think are very good that I would like to try to continue to work on as an active board member. For instance, the food program, and I'd like to make that more well known throughout the county, and ways to see if we can improve that so that we don't actually have people struggling to find nutritious food in Henry County.
Okay, so with your background in physical therapy, that ties into everything that you've seen so far from a broader perspective with public health and environmental health as well?
I think so. I mean, I think with physical therapy too, there's other programs that, like for instance, the two that are gonna start here in January, the Walk with Ease program and the I don't know the official name, the Fall Prevention Program. Those are two programs that, one's gonna be at the Henry County Health Center and the other's at the Rec Center. One of the things I know, I specifically read an article back in physical therapy school that said that 50% of those 65 and older that fall and break their hip for the first time are dead within a year. So if we can do things to help prevent falls and injuries, that definitely has a positive impact on people's lives in the community. It's just one example of where I would like to be an active member of the board. I know we have, can't remember if it's Kelly and April that do that program, or the Balance? I'm not sure.
The Balance program is April and Morgan.
Yeah, April, Morgan.
And then I actually help with the Walk with Ease program, myself, Morgan, and Angie. Between the three of us, it's a little bit labor intensive because it meets 3 days a week. So between the three of us, we usually knock it out.
And potentially that would be something, I don't know, I go to the rec center now, and I walk a lot, especially in the last year or so. So, you know, that could be somewhere if they get strapped for help through sickness or whatever, that as a board member, that'd be something I'd be more than willing to participate in. And I think with the physical therapy background, that would certainly help.
Okay, thank you.
What professional experience, education, have you had anything to deal with public health in any way related to public health in your professional life?
I think it depends on what you're referring to. If you're talking about administering immunizations, then no. But as far as public health, as a physical therapist, you're dealing with the public and you're dealing with their health. Right, it might be orthopedic, it might be vestibular, it might be cardiac. There's a lot of different rehabilitation that you would have with the public. It depends on where you're working for, whether or not any of that is, quote, pro bono. So once in a rare while, you could do some stuff to help people that maybe couldn't afford or didn't have the insurance. But that would be where most of that, but most of my experience is through athletics and physical therapy. And the best part of having worked in Cleveland and Baltimore and North Carolina and Chicago and Iowa City and Mount Pleasant is that you come across an enormously large range of people, whether it's a poor, whether it's rich, whether it's athletic, young, old. And I think that ability to communicate with a wide range of people would definitely help in public health.
Well, you straightened me out one day, I'll hold my sling up.
Yeah, and those are the things that I actually enjoy. Some people, I'm amazed at how many people don't want to ask me questions because they're going, I don't want to bother you. And I'm like, asking is one thing. I mean, that's always no problem. So that, you know.
Next question be, what do you see as the core functions and priorities of a local board in your community, in the community here? The core functions and priorities.
Well, I think some of they have some essential, like the 10 essential goals to try to serve the public. So I think supporting those would be a good thing. But the primary thing is to see how can the board members support the public health employees and the people that are there to perform their mission and their goals, which is to improve public health. Right. So I think that's the main function of the board.
What do you understand the core functions as far as the code versus the local? I mean, I'm sure you read code, what the code requirements are and things like that. You're pretty well read on that type of stuff, I'm sure.
Certainly not all that code work, no. I know that a lot of that would be is if you get on the board, you're gonna go through training
Yeah,
and things
as
like
Katie
that.
had
And
said, so.
I'm more than willing to give the time necessary to do that. One, because I do have interest in it, and two, it'd be necessary to do that well. But no, I haven't informed myself on all of that stuff at this point. I've just been going to a lot of the meetings just out of interest and try to help. I've provided a little bit of insight here and there, tried to do it respectfully if possible, to see and learn more about how things are going and if I can help with some stuff.
Thank you.
As you've been working with the boards then, you've got a pretty good group of folks, a diverse group of folks. Collaboration, has that ever been a concern or an issue with you, and the diversity of the people that you're gonna be dealing with? From not just like the board, but public health in general and the providers throughout the community, and making sure that we can cover the needs of the community?
I feel like my interaction with the people of public health has generally been fairly good, but it's been somewhat limited as I was not a board member and just a public person.
But your
Citizen.
perception as you're seeing that, do you see any?
I see some challenges coming in the future because I think
Okay.
there's two people that have been there for a long time that are gonna be leaving in the next year. And so, not board, I'm talking,
Oh, okay.
public health.
Oh,
Okay, staff.
Yes.
We do have
Yes.
2 retirements coming up this
Okay.
year, and they're
And-
folks that have over 20 years of experience, so
Right.
it'll
Okay.
be a loss for us.
And so, I think that with that that's part of the strategic, 5-year strategic plan is to help workforce, development, and that'll be, part of that is to find their replacements and integrate them into the community from that public health, point of view. As far as the board itself, it seems, I would have to say that I think myself as a person of the public has probably attended to more than 1 or 2 of the board members, but for the most part, they do well. From what I can see, it seems like you're getting the support that you need from the board, but I'd like to see more active engagement. That brings me back to a mentor that I had when I was in athletic training school. He said, don't ever become a member of something unless you're willing to become an active member. And so that is something that I've always taken to heart. And so wanting to be on this board, I don't want to just go to meetings and vote here and there. I want to be an active member. And I think that's a challenge that we've seen across the community or across the county on other boards, is to find active members that want to not only show up to the meetings, but do the things required volunteer-wise to help improve that mission.
Okay, so that's almost an example. So you say an active member and you see some things that could be changed or improved on. Can you give us an example?
Well, kind of just like right here, like I would like to see this improved upon.
Okay.
I would like to be involved with the 2 programs I already mentioned with the step off and the
But those are
Step on.
existing programs.
Step
Is there
on, not
anything-
step off.
Yeah,
The step on program, the walk-these, but
Yeah, and I understand that, those are existing programs. Is there something from your perspective, from your health background, that you see then with your engagement that needs to be improved on, or something new and different that we're not doing
that you as a board of supervisors,
as a public health department, is there an opportunity that the public health can be doing that we're not doing today to help improve the health, welfare, and being of the citizens of the county?
the
Because that's
biggest,
the charter, right?
Yeah.
Health and the welfare of citizens of the county.
It's a lot longer mission than that. We just revised
Understand.
that this
Yeah.
year when
That's
we
the
started
boil.
our strategic planning,
That's the
so
boiled down
that's the
version.
gist of it, yes.
to protect and promote the health of all people and all communities, that's kind of the base one, but there's a lot of programs that they offer that are good, like the First 5 program, which is the first 5 years of development of a child. They have the I Smile, which is trying to provide dental care for children. I think that a lot of these are good programs and that are available, but the challenge that is faced is how do you get the community aware of those services that are available? That's the biggest challenge. One way I've tried, I already asked Robin Dietrich about this, was I know that we're required to send out that tax form every year at the county's expense. And I was wondering, just out of curiosity, could we include a flyer in there that would get mailed to every address in Henry County? Because we're already mailing it at county expense, so it wouldn't be an additional expense other than maybe the cost of the paper. She said, no, we can't, because that's a government thing. But, you know, just ideas like that, I want to pursue different ways to improve the community's awareness of what's actually being provided and offered.
Okay.
Working on a board, you have a lot of different opinions and from board members. Give us an example of that you've had to do some conflict resolution in any setting that you've done in it, and to work together to a common goal.
One example that just comes to mind right now, I say, was when I was working with Iowa football, and we had a player that had an injury on game day that he wasn't really completely aware of, came in on a Sunday and was diagnosed with a fractured phalanx in the finger. The physician, who was a good orthopedic physician, was not the normal physician that day. The normal one was out of town. So from his perspective, he was seeing a lot of, accidents where pelvis is fractured and someone can't work and walk and need massive surgery and everything else. So from his perspective, this was a very small injury. Wasn't displaced, no big deal. And he kind of came off, like, oh, it's not a big deal. The player came out and was very upset. I was like, he doesn't understand what's going on, blah, blah, blah. And I was like, look, from his perspective, this is not a big problem, but I'll talk to him. But on your perspective, I get it. He was a receiver and a blocker. You have to have your fingers, right? So a broken finger is a big deal. And I said, don't worry about it. We're going to be able to make a custom splint. We're going to be able to take that up. You're going to be able to do your job just fine. And we did. And then I went in and talked to the physician about it too. And they both talked afterwards. They were both fine. Everyone was happy. So that was one, recognizing both people's points of view and where they are in life, and trying to bridge that gap so that, one, that player doesn't go back to the locker room and say, this physician is terrible, blah, blah, blah. And then we kept a nice harmonious thing going there.
And question 6, a little bit, how would you handle a potential conflict of interest between personal views of your own and responsibilities as a board member? You ever had any, conflicts of interest or anything that, with your board, you said a little bit with misunderstanding or not knowing all the full information, but, conflict of interest with your own views and the board's views, how would you work that out?
I think that would be like with anything, board member wise, is if you listen to everybody's, where they're coming from, and you also express where you're coming from, right? So, excuse me, if you do that, then you have to go based on wherever the vote goes, and if the vote goes a certain way, then that's what you support. You have to do the same thing, I think, right? If two vote one way and another doesn't, you still support that vote, but yet you express your opinions the way that you do. I don't see that that's a big conflict. I think that's the American way. You want to express your point of view and what you think would be best for the public, and then you go from there. But I would support whatever the board comes up with.
Then, with conflict of interest, everybody in that position here or your board or anything, if you had a personal conflict, you can always recuse yourself from that. If you don't feel comfortable making an unbiased, you gotta recuse yourself from that vote. We've, done that on different occasions and things like that, so you're good.
Katie or Lois or Bryan, do you have anything you'd like to add to everything you've said today?
I feel like you're pretty familiar with what we're doing because you're at most of the meetings. So do you have questions for us about?
Not particularly. I think that's, I guess the question that I have is that what are you looking for in a board member? Because I think that one of the things I've heard, even Caleb just said it, I think on Tuesday, and I can't remember if it was part of the official meeting or afterwards. But he talked about is I need to get participation from our board. And so I think a lot of your boards in the county are struggling to some degree to whether it's finding members or participation and whatnot. I think with regards to me, you don't have to guess. You already know. I've already demonstrated the behavior that people are looking for, which is engagement and the willingness to put in the time. Because I've been going, I think I've missed one meeting in almost 2 years, and I was on vacation. And with regards to, I actually came to a couple of board meetings here before you started coming, and then I took some time off, and then when I started coming back regularly, it was you and me at all these meetings. So you've demonstrated the behavior that we're already looking for. Like, you were coming a year in advance before you even ran for the position. And that's demonstrating your willingness to put in the time and the needed to do the job. So I think that that's a quality that I've already demonstrated that you don't have to guess on.
Okay, thank you. Anything else?
Anything?
And anything else?
Observing.
All right, thanks, Brian.
Yeah, appreciate you coming in.
Did you know that I'm not only one of your favorite podcasters or even your favorite podcaster, but that I'm an author too? That's right. I'm the author of this book right here, Christy's Journey, The Beat Goes On. This is a true story about my daughter and my family. Back in June of 2019, my daughter Christy, at 29 years old, experienced cardiac arrest while at work at her job in Northeast Texas. The Lord lined up angels to save her, from her fellow employees to first responders to the doctors that figured out what was wrong. It was quite a journey. It turns out that Christy was born with a birth defect in her heart, something her mother and I never knew. Her pulmonary artery was on the wrong side of her heart. Christy was saved, and our entire family is eternally grateful and thankful. I would tell our story to different people, and I would say, the Lord has a plan for us, but I'm not smart enough to know what that is. So many times people would respond to me that I should write a book. Well, I'll tell you, it was the best thing that I could have done, and I hope you are interested in checking it out. If so, it's in lots of libraries in Iowa and in Texas. If you would like to have your own copy of our inspirational experience, you can get it online wherever books are sold, or go to BoBainDesigns.com and get it for $13.57, which is over $3 off the retail price.
3 inches.
Man,
Really?
okay. Appreciate it.
And even
I'm
some
gonna sit in the hot
places got
seat
some
today.
heavy covers.
Yes,
Okay.
how are you doing?
Just like above your.
Good morning.
Good morning.
Thanks for coming in.
Mr. Grimm, I'm Marc Lindeen, nice meeting you, thank you.
Steve Dietrich, nice to meet you.
I'm Chad White. Mr. Grimm, we, like I said, we appreciate you coming in, expressing your interest on this. We did receive your resume or your job application and description letter here. We've had our HR person put together a list of 6 questions that we're asking, and we'll kind of take turns to do that, and then we'll have an open session just to share some ideas or questions, concerns, anything of that nature, okay? So, Steve, you?
Yeah, it looks like from your application, you've been in this business a little while now, right? So,
Quite a while.
quite a while. Okay.
25 years plus.
Well, that's commendable. So looking through this and then looking at your application, I think we'd all just like your perspective on why you're interested in serving on the Henry County Public Health Board and what you hope to contribute from your perspective.
Well, when I moved back to Iowa. I'm originally from Iowa, born in Dubuque, and then grew up in Cedar Rapids, and then ended up in Williamsburg, and then I moved to Ohio for about 9 years, and our only grandchild is back here, so we moved back to be closer to her. And when I came back, the housing market's not great, so, and we wanted an acreage, so I ended up in Winfield in Henry County. I like to give back to the community. When I was in Williamsburg, I ran a taekwondo school that was pretty much free to the community. And I served on the Henry County board because I lived in Henry County, Ohio. So,
Which board were you on?
the health board there.
Really? Okay. How long ago was that?
That would have been 5 years ago. And right now, I think there's a lot of, political things, and I don't want to get political by any means, but a lot of things that are happening with public health that, with Secretary Kennedy and changing, some of the vaccines and some of the requirements that, are gonna play a big role in how, public health plays out in the next few years, so, and just being part of that and being able to provide, the knowledge I have from working, in the healthcare system.
Susie, I'm gonna have to call you back, I'm in a meeting right now.
I mean, I do truly believe that parents do have some choice, but there's also a public health risk with that choice, so, it's about educating parents, and, providing them really science-backed information, not stuff that you necessarily find on social media, so, which is a hard thing to deal with right now, is because everyone goes out on different platforms and finds things, so.
The question I have is, your professional experience in education, has it dealt with public health? And I'm quite sure it has, but in the position that you're in right now, what perspective do you bring to public health, I guess? I just have.
So, very huge, for dental care, we're one of the only places that if you have Medicaid, that you can get dental care in southeast Iowa right now, so. You go into a lot of the private dentists here in Henry County or Mount Pleasant, they're not gonna take Medicaid. Or did I say Medicare, Medicaid, I meant. So, that's a public health emergency. We don't have enough dental care for the kids that are on Hawkeye and, those care. When COVID hit, I spun up, was instrumental in spinning up one of the first COVID vaccine sites, so, we provided 300 vaccines a day to patients in Ohio, in the Toledo area, in the Lima, Ohio area, so, it's very important, the VFC vaccine program, providing kids or parents that can't afford vaccines, that vaccine, there's just a lot to public health, and there's things that we're not even hitting on, right now, why is Iowa's cancer rates, skyrocketing, that, we can make assumptions that maybe, we're in a farm community, that there's a lot of stuff going into the groundwater, but how do we know that? That plays into public health, and I'm not gonna say that that's what's causing it, but there is proof that Iowa's cancer numbers are skyrocketing, so.
I remember when community health was formed even, and so, is there anything that the public health board can do with you or vice versa to grow what we need in the county?
There is, looking at grant opportunities. I was just gonna share that, Community Health Centers of Southeastern Iowa was awarded $1 million contract to help with the opioid use disorder contract in District 6. So, we're gonna be spinning up a huge program in Keokuk to treat patients that are impacted by opioid use disorder, and that's all money that's coming without tax, taking a dime from taxpayers. It's from the settlement funds, so, it's finding those programs, knowing what's out there, finding grant opportunities. honestly love to expand, our board would love to expand into Henry County to provide dental services here, but, you know, right now there's uncertainty, so, you know, we're being very cautious where we expand because, you know, I mean, we looked at the old furniture store out next to like Casey's to buy that, and would be very happy to come into, you know, Henry County and provide services, but like I said, we have to be cautious about, you know, what we're doing with, you know, funding changes that are coming, and whether you know, like the big beautiful bill, don't like the big beautiful bill, it is gonna drastically change healthcare in the United States.
So you do a lot of grant writing right now, or
Yes, we do. So we've also went after the Rural Transformation Funds grant, so we've got applications in for $480,000 from that grant to bring new providers into southeastern Iowa.
Okay. Gonna go along with the core functions. By code, I think Iowa code defines what the core functions of public health are. You're familiar with that.
Mhm.
Everybody, the board's familiar with that and everything. Are there things that would go above and beyond the things that you have not mentioned so far? You've talked about the dental, you'd like to implement a dental thing through your business there and whatnot, community health. Is there things that we could tweak locally that would still be compliant with the code? I know you you just said something about the opioid usages of that money.
Mm-hmm.
I think that's kind of an underutilized pool there. It was put out there to use, and it seems like there's very limited little uses that we can do for that. I mean, it's not a never-ending pot by any means, but it's something that we could potentially utilize. So.
Yeah, I mean, I'm working with right now because we were just awarded the grant, just got the contract and signed the contract yesterday. I'm working with Lee County, so Michelle from Lee County, and then I can't remember the sheriff's name. In Lee County, it's Ellis or E. It starts with and then chief of police in Keokuk, and the chief of police in Fort Madison. I'm gonna meet with hopefully the Henry County Sheriff here shortly. Obviously, you set up a meeting with you to discuss how we can actually work to keep these patients that, you know, are treated with Narcan. They're usually getting sent to like Henry County Hospital, and then they're getting streeted. There's no taking care of them. If you just fix someone with Narcan, yes, you save their life, and that's great. And we can provide Narcan for, you know, the county and have Narcan dispensers throughout the county. But if we don't treat the underlying issue and get them into long-term treatment with mental health or to help control their pain management, they're gonna keep using that system and keep having to have Narcan. So, you know, we've got the opportunity with, like I said, non-taxpayer funds to actually make an impact on these people's lives and get them in. We're building a transportation network as well to, you know, if someone can't get down to our center in Keokuk, we'll actually send a driver up and pick them up and bring them down to a visit and then bring them back home. So that's, you know, all stuff that we want to do. And so, you know, there's just that. We've got to quit being individual like entities. Like, you know, when we even went after this grant, we worked with Dr. McCoy from the CEO of the hospital, and he said, you know, are you going to treat patients without them being a primary care patient? I said, yes, we will treat anyone that comes in our door. You know, they don't have to be our primary care patient. They don't have to be a dental patient or a VH patient. We're going to take care of them. And we've got to start working together with as hospitals, you know, private practice dentists, everyone working together if we really want to, you know, change health outcomes. And honestly, you know, we're also, you know, one of the biggest industrialized nations that does not have universal health care. So, I mean, you know, we're gonna see, you know, yes, Dr. McCoy, yes, me, yes, any CEO of the health system, we're gonna see a huge hit in the number of insured patients. And when that happens, there's gonna be a public health crisis. Like, there's gonna be people that are using the ER for their primary care, and those ERs are gonna close because.
I think that happens now.
What?
It's
that
gonna
happens
get, it's
now.
gonna get
It's gonna
worse,
get worse.
so.
I mean,
It's already happened, yeah.
I don't know a CEO that will tell you that it's not gonna get worse with what it was, I mean, and I'm not against that we extended the tax, you know, the 2017 tax. I mean, I am very conservative. We need to quit spending, you know, money we don't have. But this is gonna be a huge hit to patients, and then they're gonna look at, you know, public health organizations and your grant, grant funding the public health organizations could go down. So, you know, one of the things the board told me is go after every grant you can find, and I'm looking at every grant we can find to, you know, go out and provide services so we can make sure that we're still here in 20 years to provide services for, you know, our patients and the patients of southeastern Iowa.
Okay. On a local basis, here in Henry County, I like the idea of getting rid of the wash, rinse, and recycle thing with the opioid. To get to the causation of the problem versus just treat.
Giving more people Narcan.
Yeah.
We have Narcan, it's there. We've
Yeah.
had so much it's expired.
Yeah.
So is that a good use of those dollars? Probably not.
Well, that's what we're looking at too. It's $13 for, with 340B pricing on Narcan, it's $13 for 2 doses. So, you know, we can go out and buy a lot of doses, but we wanna be very cautious. I mean, we don't wanna go out and waste $2,000 or $4,000 by, you know, putting Narcan.
But to have providers in place that can treat these people for the disorders, there's very few and far between in this area. So if you can put the dollars in that situation where people are actually being treated for the problem, where you're not seeing these repeat offenders, I shouldn't say offenders, but
Yeah,
repeat patients coming in through the ER with the same problem.
They need to be put on Suboxone, and then they need to be treated, like, you know, even with ads, which is a big, you know, their Suboxone clinic, the patients have to come every day to get that Suboxone. We're a little different model. We'll actually give you Suboxone for like a week, so you don't have to come in every day. But, you know, you'll see at the ads thing when those patients come in that want to be treated and helped, that they have to leave work and come and stand in line and wait to get their little thing they put on their tongue. And I don't know if you know what Suboxone is, but it's basically the primary drug that's used to help people, you know, settle that craving for opioids. And that's how you long-term, you know, will get someone off opioids. But then, like I said, when you work on that, you've got to deal with their mental health issues. You've got to deal with their pain issues. So, you know, some of these people had an injury and then they got on overprescribed opioids and then they got hooked, and then, you know, the opioid prescribing model changed, so, you know, it's harder, you know, to get those drugs. So then what do? They go to the street and get fentanyl, which could be laced with God only knows what, and, you know, that's what created this crisis. You know, I have a unique perspective because I lived in Toledo, Ohio, which is right on 80 and 90, which is the big, huge opioid crisis there, you know, with the 2 big interstates running through there. So, And we did a lot of that work in Ohio. And I think, you know, that grant funding is also meant for people that don't have insurance, so, you know, we can provide that service, and, you know, that's why, like I said, I need to meet with law enforcement, so, because when law enforcement, you know, deals with these patients, you know, if they can get them linked to, you know, care, even if we have to come up and get them, to pick them up from the jail, to take them down to our clinic or whatever, you know, then, you know, we're gonna do that, because if we just keep treating them like we have, there's not gonna be a change.
Have you ever worked in a secured jail environment or anything of that nature?
I have not, no.
Okay, when you're talking about transporting,
Well, yeah,
somebody in
yeah,
jail, that creates a whole nother.
Yeah, and I don't really
world
mean
of-
that we take them out of jail, because, you know, if someone overdoses, if we're just putting them in jail, that's probably the wrong, I meant more like if they're.
Like
if the
an ER
police-
yeah.
situation.
Like, you know, somewhere,
Yeah.
not, someone incarcerated, we're not gonna go without actual law enforcement coming down with them to treat them, but we do have, law enforcement come in with patients today.
Anything else, Deb?
How would you handle potential conflict of interest? If you had a conflict of interest with something that was going on in the board, a program you'd like to see implemented, anything like that, how would you handle a conflict of interest in that setting?
The same way that our board members would handle it, they abstain from any vote or, you know, step out of the conversation. So, you know, if we were discussing, you know, something that benefited community health centers, the Southeastern, I'd have to step out. I mean, because I don't want to have any conflict of interest happening. So, I mean, it's basically, you know, we have a board member that actually does our medical insurance quote, and when we're actually discussing those quotes, he has to step out and not be involved in those at all, and that's the same thing that I would do.
Do you have any examples that where you've worked on a board, or that there's been conflict or any situation at work that you've had to help resolve the conflict?
I've not really had one where I've had a conflict, because I haven't been on a board member where
Or any work situation that you dealt with conflict between two people that try to make them work together?
Oh yeah, I mean, I've had numerous.
Every day?
Every day.
Every day, yeah.
Okay.
Yeah, I mean, when I was actually, with, you know, the hospital, and I was with Memorial Hospital, that's now Compass Memorial in Iowa County, before I moved up to Ohio. And I managed multiple departments, and I had someone come to my office and say, I can't work with this person, like, you just have to either split us up, like put me on the other side, and, you know, I just brought them into my office together, and was basically, you know, the person that sat there and listened to each side, and, you know, gave them, things that they could do to work together, and, you know, that came out okay. I think right now, in the most current role, our CMO, Chief Medical Officer, Dr. Hartley, has stepped down. I mean, she's gonna stay a physician for us, but she's not gonna be our CMO anymore. And I think that's because, you know, of conflict that we've had, which is really good conflict. I, you know, told her that, you know, really as a CMO role, I needed to be an educator for our providers and a mentor for our providers, and she doesn't like that role. So, and we've, through conversations, come to terms, and she wants to stay working for us, but just doesn't want to be in that role. And so, you know, it really is a matter of you have to be honest. You know, if you look at coaching or, you know, working with people, coaching is not a bad thing. You know, looking at Phil Knight, who's a great coach, and he had conversations with players, even Michael Jordan, about how he can get better, and that's all a coach is doing, or a good manager or leader is doing, is making someone better. You know, really, if you're not talking to someone, coaching them, mentoring them, then you really don't care about them, in my opinion.
I heard that put polishing the gemstone out of people. Anything further?
Not for me.
us?
So I don't think we introduced, this is Lois Roth. She is our current Board of Health Chair.
Hi.
So,
Nice to meet you.
and we've met before, so what questions do you have about our board?
I guess, why do you typically, when do you typically meet?
Wednesdays at 12:30 is what we've done for several years, because it's worked out on everybody's schedule. But every year we review that, which we'll review tomorrow.
It's coming right up.
And then, I mean, once in a while, we'll have several other meetings, like if we're interviewing somebody, or if there's something else going on, like we might have extra meetings for budget or anything like that, so. And Katie and the previous director were always very good about calling if they thought there's something that we need to be aware of and if we need to get involved in. So,
We do
it depends on
have,
how much time you wanna put in.
Okay.
we do have a virtual option. Our medical director is Tyler Miller, who is a nurse practitioner. He used to have a practice in town and now works out of the University of Iowa at Riverside. So he's usually virtual just because he's in clinic. So that is an option too, because I know you are working and you're busy. And like I said, we can review that time. I'm pretty open. It's kind of what works for you guys, because you are volunteering your time. So typically the agenda's out the week before. I usually have a Board of Health report. We go over budget, so expenses, revenue for the month. If there's any new issues come up, and then environmental health for us is contracted out through Roth Regional Utility Services. And so they usually make it to the board meeting and then present any of their statistics, but sometimes it's short and sweet, sometimes we have a lot to talk about, so it just depends.
We review policies and procedures.
We do that, yes.
Yeah,
We have a policy to review the policies every 3 years.
Yeah.
So,
but we kind of divide them out so that they
so it's not all at
aren't
once.
all at the same time.
And anything new that comes up, if there's new policies that we see coming down the pipe, then, one of the things that we've been working on the last several months is strategic planning. We didn't really have one. The state has consultants at no cost, so we've been working with them to try and get us in line as to what do we wanna focus on. The other thing, big project that we were working on is optimizing our EHR, because we feel like it has a lot of functionality that maybe isn't being utilized. We're not getting the bang for our buck, so we've been working with the vendor to try and optimize what we're doing there, and it's actually kind of streamlined our billing process that we do for vaccines. So those are some of the behind the scene things that you guys are all involved in.
And with all the changes that are going on with the state, oftentimes we have to discuss that, so.
There's been talks
How
of
we're
the public
possibly
health.
gonna approach
Yeah, this realignment that's been coming for how many years now,
Yes.
before my
Yeah.
time.
Yes.
But, the behavioral health realignment, obviously, went into effect in July, and so we've been watching that closely. And there's supposed to be legislation that's coming to the forefront in January to tell us what's gonna happen with us. And there's been a lot of back and forth, a lot of it's on, it's off. So, trying to keep pace with what's going on at the state level. The state kinda has all the dreams and ideas. They send us our marching orders. We look for funding, which is always, as you said, a challenge. And then try to fulfill what we can based on what the state health improvement plan is. Our community health improvement plan, I know you're familiar with, cause you have to do one too. So that's, every 3 to 5 years. We used to work with Henry County Hospital on it before they were, before they joined, I don't know what the correct term is there. with Great River, but now we've kind of, public health is only required to do that every 5 years, and that's kind of a big project too. So our last one was in 2023.
Okay. So what are your 3 primary priorities, concerns coming into 2026?
And so if you go by our strategic plan, or you go by just what my concerns are right now, my biggest one is the Rural Health Transformation Fund, because I think that with the One Big Beautiful Bill Act that came out, the Medicaid cuts, that money is supposed to replace those Medicaid cuts, but it's over like 5 years, correct?
Correct. It's,
So-
yeah, we got awarded 200, or Iowa got awarded 209.
209, yeah.
Which is when you're taking
We looked,
billions out.
it's a lot of money, and we looked at the RFPs for it, and the turnaround time was like 3 weeks. It was something ridiculous to try and figure out how to spend. I think our chunk would have been like $16 million in 6 months. So with a staff of 8, that's not really feasible to try and get that amount of money out of the door. There haven't been there was one public health department that did end up going after that funding. It's in Monroe County, and their plan was to split it amongst all 99 public health departments. I don't know how that will go, but I wish them well. It's the ridiculous amount of administrative work. And then
in those 7 RFPs, there weren't a lot of opportunities that really,
not
in
for
my
people at
opinion,
the local level or at the rural level.
It was, I mean, there's good things with the, cancer thing to get, fit kids out, but work on that, but the way they built that.
The way they designed
it's
it.
making it so one company is gonna take a lot of money
And that's our grave concern, is it's gonna be farmed out to whatever for-profit company writes the fanciest RFP, and then we'll hope for what trickles down. But I guess I was more under the impression that that money would be for rural hospitals, but that's not promised to rural hospitals.
No, the only thing that even came out of that is like, Henry County could have like asked for a Da Vinci robot, like spent a grant.
Right, right, but then you have to have somebody who runs the Da Vinci robot.
But then you're also, when you get the Da Vinci robot, you need the surgeons to run the Da Vinci robot, but also they're talking about doing a hub and spoke model where they don't want a Da Vinci robot in Henry County Hospital. They want people to go to Great River in Burlington and have a Da Vinci there, so it doesn't meet what critical access hospitals across Iowa have tried to do the past like 15 years.
Telehealth will be interesting, if there's any telehealth services that'll be expanded so that access to care is better. Because we used to have a ton of specialists that came down here, and that it has dried up too.
Well, even in the VH care, they're breaking telehealth, because now you have to, if you're a brand new patient, you have to be in person, or every year you have to have an inpatient visit, and it has to be with a like provider.
Right.
So, like when we have providers that sit in Burlington that are providing behavioral health services to Keokuk, Henry County patients, those patients will now have to come in for a visit one time a year, which doesn't seem like a lot, but
if you don't have a car and there's no public transit, that is a lot.
Or, if you choose to see, like Shane is one of our only male prescribers, and he sees patients in Keokuk, well, they want to continue seeing him, they're gonna have to come to West Burlington one time a year. That's why we're building the transportation network, so we can actually transport those patients, so they, when they don't have a car, because there's also not a transportation network that's necessarily great across southeastern. I mean, there are.
Have we used C-Bus for any of that kind of stuff, Katie?
Yes, but the problem with C-Bus is it's not like you call them up, they come pick you up.
It's 2 days.
It's 2 days before, so if you have a crisis or something like that, that doesn't always work. And then you have to hope that you're on the route, there's available drivers, depending on where you go, they don't just drop you up and pick you up.
Right.
Like if you go to the University of Iowa, you might be waiting all day for everybody else to get done, which, depending on what kind of condition you're in, might not be feasible,
Right.
so.
Okay.
So
might be a long way.
Might be a very
There-
long way.
There are options out there, but it's not patient-centric at all, and it makes it hard for people to get the care that they need.
We should revisit that a little bit with C-Bus, because obviously they just built a facility here, so we should, I'll talk to Patrick and see what we can do to improve that.
Chad, what else?
I don't have anything else.
I don't have anything, but I appreciate
Yeah,
having you come in and
thank
getting
you.
to know
Yeah.
you, so.
Yeah,
Nice
thank
to
you.
meet you.
Thank you.
Nice resume. Nice
Thank you.
application.
Thank you.
And
I mean,
obviously, you
even
guys.
if
know
you
what
choose
you're
someone
talking about.
else, it's great to meet you guys, and like I said, I'm gonna work with you on getting
Right,
the opioid
we
use
are open to
disorder.
partnering with whoever we can.
So,
Funds are limited, so.
Well, and that holds true. I mean, the county funds are limited. I mean,
Exactly.
we're not just flush with money. I mean,
Well, I mean, with property tax reform, people in property tax reform, I mean, it's, obviously, everyone's sick of paying all these taxes for everything, but that's what we fund a lot of programs with, and,
no, we're,
Our opioid fund's quite flush right now. I'm looking at
213.
213,000.
yeah, so, I wouldn't want your guys' job.
Thank you.
But I have a hard job, don't get me wrong. But, you know, so.
All right,
Thank
thank
you
you very
very
much.
Yep, bye-bye. It was
Have a great day.
meeting you.
Yep, thank you.
Thank you. Thank you. I enjoy your podcast.
Thank
I
you.
hope watch this.
Nice to meet you.
Thank you.
Thank
Thanks.
it's vacancy.
That's gonna be hard. It's a hard trip.
So,
When do you wanna do that? And what are your plans, what are you thinking here? Kate, you have a meeting tomorrow at 12:30.
Tomorrow.
You'd like to,
It'd be nice to
you
have
would
a
like to
full
have somebody
board,
to
but,
announce.
I mean, in all actuality too, if you're making an appointment today, I don't know what all of those people's availabilities are, so there's no guarantee that any of them would be there,
Sure.
or that they'd even know what's going on,
But at
if
least
it's
there'll
somebody,
be
yeah.
somebody you can contact.
There'll
and
be
work with.
somebody, hopefully we get one on. So,
All right, Jed, can we take a 10-minute break?
Sure.
I need to hit the restroom.
Hey, thanks for watching the podcast. We're taking just a quick break here because I need to share with you how you can get one of these cool t-shirts or one of these cool hats or this huge, let me just make sure I'm holding this right, Southeast Iowa Today with John Bain blanket. Oh, man, it is soft too. Anyway, all you gotta do is go to a website called Bain Designs, and that's what it looks like. You can see it there. Once you're there, just search Southeast Iowa Today with John Bain, and boom, up comes that. And you can get stuff like this, a tumbler that says Southeast Iowa Today with John Bain, and on the back, stay friendly, Southeast Iowa. And don't forget the ever cool Southeast Iowa Today with John Bain coffee mugs that also say stay friendly Southeast Iowa. It's all there. And why am I telling you this? It's because I appreciate you, and I know that you tell people about this podcast, but this is a way for you to become a walking billboard, get some conversation started, help me promote your favorite podcast. And once again, I thank you. And this was a long enough break. We got to get back to the podcast. And, you know, stay friendly, Southeast Iowa. And thank you so much.
Make a change in the structure of the board. Would we have to have that as an agenda item on our agenda?
Oh, I'm sure we would.
I'm
I think so,
thinking-
yes.
do you really wanna do that
You know
though?
what?
It was just a pipe
I'm not
dream.
trying
I
to
don't
take
think
the chicken way
no.
out.
That
anything
gets
at all.
more
We have
people
three excellent
involved
candidates.
and more
And they said we could go to
ideas
seven
to-
members on the board.
back and forth, more scheduling conflicts,
Actually, no.
more.
Scheduling conflicts is, I feel like we have a hard time getting everyone to the table.
And I think, you know, I think we're pretty good about not having people who do not have an agenda.
I would agree with that. We,
Unless
in my experience,
Yeah.
the board hasn't come in with somebody trying
we
to
haven't had
push
some, no.
one thing or another. We talk to other counties and there are people that do come in with an agenda. We've had counties that have board members that are opposed to vaccines, so they get on the board so they can push that agenda. And we really don't have a lot of that. We have a fairly neutral board. They don't always agree on everything,
No, we don't always
but
agree, but
that's like,
that's why you're on it, so.
I
Like you
see
guys
every
don't
one of
always
these
agree.
people bringing something great to the board.
Mhm.
And so that's why I like the idea of the expansion. I'm not talking, like I said, I'm not talking the chicken way out at all in this one. I really see the potential that we could have in our public health board expanding farther. And yes, and I've been to your board meetings, Lois, and
Yes, I know, and I think it would just make it more difficult.
I
You don't
would-
see any real value in going to a 5-member, from 5 to 7?
Yeah.
No value, okay.
I would
Yeah,
second
and-
that.
And like, I mean, we're not a big enough county, and if we're going to end up being part of other counties, then you're gonna have,
It'll be a mess. So there is a possibility, like with the public health realignment that's going on, when we district, you've seen what has happened with the mental health, how we have boards through Iowa Primary Care for each district, and they've consolidated the counties. So I don't know what will happen with our boards of health. It's something that the public health administrators are being very vocal about. But if they realign and district us, there is a possibility that boards will be combined.
I respectfully have a different slant on this side of the board, having dealt all these years with the mental health portion of it, and seeing what has happened with the board, the counties or the regions that had a large influence, had a better chance otherwise on. So that's where I'm coming from with what Katie just said too.
but I think you also have to look at if we're doing the right thing. I mean, there are a lot of things that need to be done, we don't have the funds to do them. There are a lot of changes, it's like mental health is one of the hugest ones, we need a better system for mental health, and as long as I've been a nurse, it's always been the deputy sheriffs who have driven them all over, and when I worked in Cedar Rapids, you know, I'd see all of our EMT guys bringing people up there to mental health.
Yeah, but we did do a little bit something on that when we had the officer training that could diffuse a lot of that stuff.
Yes, speak up.
I said, we did have the training for our officers, which
Right.
could diffuse a lot of it, and we do have the term that, for the crisis intervention people right
Right,
now are coming,
right,
and
yes.
I've experienced that firsthand too, so,
But, and the thing is, having a bigger board, you may have more ideas and be able to expand some things that way, but we don't have the staff
We
to
don't
cover
have-
it, so
right.
it's not gonna help. I mean, it's just like creating a bigger problem.
I like the idea of having this is a local board. This is Cornfield County, Iowa. This is small, I mean, you know what I'm getting
I
at.
know what you're
mean,
saying.
we're a small county. I like local involvement. I like people that have been here, that got, in my mind, a good fingerprint on the community as a whole. I like that idea. I just like the idea of them knowing the different family connections. I like the family histories. You know, a lot of people know what the family histories are. And I think that can be beneficial in so many ways.
Yeah, I would agree with that. You gotta have somebody that knows the community and understands what our community is about. Kinda goes back to being more centric to the
what we're supposed to do from a county perspective. And the people that have been here and know the individuals makes a big difference. They know what the dynamics are, what the conflicts could potentially be, because they're more centralized and they're familiar with the location, the area, and the dynamics in the area.
But what you were talking about prior, I can see where Mr. Grimm has a great advantage in helping the board and possible funding and doing the things that you want to. So there's also why I'm looking at, if we have someone like him on there, and with the 2 other board members, in addition, should solve a lot of the potential problems, your conflicts that you're seeing.
Could the
I don't-
collaboration?
I don't
Sorry.
think that Bryan would need to be on the board for us to collaborate with him. I think he's very willing to collaborate with us, and quite honestly, his wealth of knowledge is in one area which we need help with, and I'd love a collaboration with him. But I don't think he needs to be on the board to do that.
And who are you speaking of?
Bryan.
Bryan Messer?
And he is an amazing candidate.
Okay. But you could still interact with them and still engage them and
Absolutely.
work with them, okay?
I mean, we already are.
We already are, and with the changes that are probably coming, we're probably gonna be working with them more and more, so. And he's part of our, I mean, basically, since he's working with Great River, he's part of our system too, because we're actually Great River, so.
He's working with Great River.
You're talking about Bryan.
I mean, he's not with the Great River, but he's associated.
Are we talking about Bryan or?
No, I'm not talking about Bryan.
Oh, Bill.
Bill, I'm
Okay.
talking about
Bill
Bill.
Grimm.
I was talking about Bill the whole time, sorry.
It's okay.
That's why I asked.
Thank you. No.
And I like that idea of the collaboration before, you know,
Yeah.
if he's available to do it as a board member, there's no reason that he couldn't do it as
Yes.
a contact or a person that could be approached and do that from the outside, looking in to that a little bit.
And you know, like we're doing with almost anything in our world, in smaller communities like this, we've gotta work together with other communities. We're not gonna be, it's only gonna make us stronger. And have more, things available for people too.
And I think from a fiscal standpoint too, there's no sense in everyone paying for doing a different thing 99 different ways.
Exactly, yeah.
Rather than reinvent the wheel and
Right.
borrow that spare tire over there and get it done type thing.
I think we're narrowing it down.
Well, not necessarily.
We only have 3 to start with. How much more can you narrow it?
2.
I just,
It's true.
to go off what you said, Lois.
Yeah.
I can just go over and take the flip side of that and see where that would be advantageous to have someone like that on the board.
I'm
And
not
be
saying
more
it wouldn't be
involved.
advantageous to have him on the board, but
More
with
involved.
what we have right now, and that's one area, which is great, always to have a lot of areas, represented, but I think it would be better to collaborate with them, because that's gonna be way more long-term and have a lot more advantages to collaborating on the side with that. I mean, it would give us advantage to have him on the board, yes, but we don't need him on the board to collaborate.
I respect that.
That'd be my perspective as well.
Thank you.
We're gonna still collaborate either way, probably, especially if they put a facility here, so
Yeah.
the collaboration is there, we just don't need to actually have them on the board to do that. But he's got a wealth of knowledge, and that's always good, right? A wealth of
Yes.
knowledge.
Yes, he does.
Any further comments, pros, cons? I mean, this is the vote that we have to do.
Yes. Well, I can tell you who my vote would be, but don't know
Right.
that that's fair.
It isn't.
They're gonna put you on the spot.
What?
Won't put you on the spot.
I think just making sure that you have someone that's qualified for the position, that has at least some know-how or background in public health would be helpful. We've kind of gotten ourselves into messes around the county when we don't have people in positions that know what they're doing, or who have the best interest at stake. So I guess that would be my concern, just make sure that it's somebody who has at least a little know-how in public health and who is willing to be engaged and participate. So we have some members of our board that participate more than others, and everybody's got a life, and we just need to make sure that those people are available. We have very good candidates, though.
Well, that's kind of the impetus of scheduling interviews.
Yeah.
Yeah, because everybody has high points.
They
that
do,
would
they
be
do,
good
everyone's
shares.
got strengths, so.
I was gonna ask Bryan this and I didn't, but again, I know you and I had this conversation. Why did he use public health's phone number for a reference point rather than his own personal cell? Do you know?
I think you could ask him that, but from my understanding, it was that he didn't want his cell phone public.
Okay, but again, we're doing an
You
application.
know, there's a lot of things that I personally have dealt with things confidential all my life. And a phone number is pretty trivial.
Correct.
Again,
I don't direct it at me,
no,
I didn't write the application, so.
I know, I'm not.
It's just a little concerning that we
I
have to call you for a
when
reference to get information to contact an applicant.
Yeah, because when I called to make the application, public health answered, like, did I hit the wrong number? You know, I'm thinking,
And that's why I called right back. I was like, no.
and so, it's like, then I looked the number up and like, no, that's not a public number. I know,
Okay.
I guess I would entertain a motion for you guys' opinions on who you'd like to fill with, fill a position.
All right. Well, if you'd like a motion, I'd like to nominate Gloria Fear. I think she is a very qualified candidate. Goes right back to what Katie said. She's got a lot of qualifications, got a lot of background, has obviously been involved in the community, 40 years of experience in the medical field. So I think she has a lot of potential to offer.
I'll second that for more discussion. Part of the discussion is, I'm gonna ask you two, directly to you, about the seven-person board, and you don't see that being advantageous at all.
I'm sorry, say that
The
again.
You are against a seven-person board,
Is there a reason why I am?
well, other than what you're saying, you don't see the need in it.
You don't see the value
You don't see the
in
value in
expanding?
it at all.
I don't see I mean, it's just, yeah, no, and partly because we are a small community, and I like all the different opinions, and that's great, and I don't always agree with everybody any more than anybody always agrees with me.
But I think also if people want to voice different opinions, they can come to the meetings.
Yes, they can always come.
We have open
Yeah.
meetings too.
Yeah.
So if they're open to the public, Bill's come before.
Yeah.
We don't have a lot of people that show up at them, but once in a while, we do have some interest, so.
As far as making us a better board, I don't think adding more people is gonna make us a better board.
I think it's gonna make life more complicated, honestly. I mean, you've obviously been doing this longer than me, but it's hard enough to try and coordinate with a 5-member board. And is it gonna, it's a nice to do, but is it going to add value to what we're already doing or not?
That's what I'm saying.
So we can gather opinions from whoever we wanna gather opinions from, but, you know, is it going to change how our board is already functioning? I mean, you do gather opinions from the public, you do talk to people. Most of our members of the board, I would say, are active in the community.
And almost all of us go and work at any of the,
They do, they volunteer
that
at
we put
most of
on.
our events. We can't do it with just who we have, so they've always been good about coming and helping.
and
That's
those of
the
us that
question.
could would always volunteer for immunization clinics and.
And I guess I'll add this. I know the gender equality of the board is no longer a legal requirement,
Correct.
but is it maybe a good idea?
And I would agree with that, and I would have brought that up, but I know it's not a legal requirement anymore, but.
It's not a legal requirement. Then I think of, Mr. Grimm seems to be the boss man. I mean, he's kind of the boss man. And as a board member, we would hope that there wouldn't be that flow over into that. I like as I mentioned before, I like the idea of somebody being, local, connected, in tune with the medical profession. To kind of echo along with that. The PT and physical therapy that little niche maybe has already been addressed on the board.
Mm-hmm.
It has a little bit of an element there of that board. A nurse went off with Mrs. Savage. She kind of fit that same niche that she knew everybody in Southeast Iowa, I think, and knew real community connected, I
Yeah,
guess.
she's involved in the ministerial group, so,
Yeah.
yeah.
So. Further discussion?
Not for me.
The motion was, and a nomination was from Steve for Gloria Fear to fill the vacant Board of Health position. That was seconded for discussion. We'll call that question now. All in favor of Gloria Fear to fill that position, say aye.
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 It's hard.
Do you have, I have a copy of her contact, I need her contact information so that she can go through training.
You want to copy this?
Yeah, I think I have it already, but not
Did
on
you
me.
give this to us?
I did give it to you.
You're right.
I gave all of them
I think you
to
told me
you.
that the other day, didn't you?
I did. I know. I have to just,
Well, ladies, thanks for your input. It helps.
You're very welcome. Thank you for being very open.
Yeah.
How you doing, Bill?
Now, Lois, that, wouldn't be an undue influence. Would that have been your pick?
Yes. So thank you.
So does that term run
Katie,
through
did
28?
you have a pick?
hmm,
Did you have a pick?
I did. Alright, thank you.
Katie, does that term run through 28? It's a
Yes,
3-year.
it's 28, and then next year we'll have Matt and Mike are
Right.
up.
Yeah.
And I don't know what either of
That's
them
why
wants to
get
do.
this squared away.
I don't know either, Mike.
I haven't
This
asked
house,
them,
I'm
we've
not
got lots,
sure.
I know, that's what I worry about.
Chad, are you gonna follow up with Ms. Fear?
Yes.
Okay.
And, I'll follow up with everybody.
Okay.
Good to see you, Bill.
Good to see you.
And you're gonna follow up with her as well then, to make sure she
Yeah,
gets everything she
we'll,
needs?
I'll have the state consultant follow up with her, so they do a whole
That's a long story.
training session. And then I'll have to get with her
Got
on
it.
IPIP training too. I think they have 90 days to get that done now. And I'm not sure who's enforcing it, if anyone's enforcing it or not, but, so.
But, with Mr. Grimm, that would be something to think about, reaching out to him to,
Well, also, I won't say. I was gonna say that, we could pull him into Callie's job maybe. Cause she's retiring this year.
No, she's not retiring this year.
She's not retiring this year?
No, Robin and,
Robin
Angie
and
are retiring
Angie are.
this year.
Okay. All right. Thanks, guys.
Take care.
You too.
So with that, you guys, we have, I've asked Terry Smith to follow up on, the fire dentist for Mount Pleasant. He was gonna contact Chris Steffensmeyer. That was an opening.
And the other two will
They're gonna stay?
They'll stay.
Okay. So I'll get those squared away and we'll be pretty good. Caleb Waters has not gotten back to me on.
Okay, did you guys read the email from, Weed Commissioner Gailey?
I did.
I think that's something that we need to make sure that, Jake is on board with that.
Yeah, I think we need to visit with them first, just to make sure we understand.
Make sure that
what
that
he's
would be
doing.
a good, cause I know Mike had commented about that before, he said, if I'm there looking at weeds and it happens to be on the roadside of the ditch, versus the private property, he says, you won't get anybody there any faster, any closer, or, you
Yeah.
know,
He's
to be
right.
able to apply it, and he says, I always have a hand backpack type sprayer that I can spot spray those noxious weeds and be done with it versus do the chain of notifications and then the work orders and things through secondary road to have that done, so.
Just allow him to have some chemicals.
Yeah, so, cause I mean, I know historically, there's been some noxious weeds growing on the inside of the fence on private property. And then if he's looking at it on the right of way, he says, can I treat it? And I said, let's hold off on that idea. This was last year.
Right.
Let's hold off. I said, I like the idea of being efficient, you know, that makes sense.
Having to come back doesn't make any sense.
But we wanna make sure that
so,
is good with the county engineer as well.
Yeah, well, at least they need to be in touch
Yeah.
with one another.
And it sounds like they have basically done that.
You would think that with our technology, we should be able to drop a pin and say,
I think
I
so.
sprayed this.
Yep.
They are.
They are not.
What'd you say?
The secondary roads are.
They are, but they don't have that, they have not been doing it, they're not at that level at this point, to be able to say, we pinned this because we know there's weeds there, or we pinned this because we know we sprayed it. Cause I specifically asked Jake about that. So,
You know,
we could get there.
years ago, I mean, if we saw a pot of, a growth of pot growing, we took our colored pencil on our plat book and made a little circle on it, you know, type thing. But, yeah, with modern technology, I mean, drop a pin exactly where it's at and boom, you know,
Yeah.
send that email image to whoever. And,
Keep track of it, make sure we're good.
After we're done, I'm gonna tell you a story about that, about my mother, you'll like.
About
Off
your
camera.
mother?
About my mother, yes. And he knew my mother, so.
I just ran across some pictures of your mom and my mom in their painting days.
Are we
They had
done?
they had a lot of good times together.
I'm sorry.
Are we done?
Any further business? There was nothing on our agenda, so we
That was it.
Make a motion to adjourn?
adjourn, motion to adjourn.
Your turn, move, adjourn from the chair.
That's right.
Motion to adjourn. I hear two of them. We are adjourned at 10:15. I will share.
Congratulations to Gloria Fear on her appointment to the Henry County Board of Health. Hey, do me a favor and give this episode a like, follow, and subscribe. It is free. Thanks for watching. Thanks to, of course, my sponsors. And you know who they are. You probably can say them better than me, but I really appreciate my sponsors. Griner Auto Body, Car Doctor, McDonald Boneyard, Your Choice Family Restaurant, Girling Repair, B&B Propane, and the family of Jet Stops, CW Tree Trimming LLC, Iowa Technology Systems, Dutch Market, and Coffee Talk. I'm your host, John Bain. Happy New Year and stay friendly, Southeast Iowa.